Hi, Courtney. Good to see you today. Today I'm with Cortnee Wright, Clinical Director of Shield Bearer Counseling Centers, and today we're going to be talking about the topic of trauma. I just wanted to know a little bit more about what trauma is. It's talked about a lot, and people use that term in connection with therapy, and I'm just wondering, what is the definition of trauma?
That's such a great question. Trauma right now is really a buzzword, right? It's out and about. A lot of people are talking about it. We see it on the news. It's a great question. What is trauma? When I talk about trauma, I basically explain it like this. Person may experience an event. They may not even identify it as traumatic at that time, but it is a life-shifting event. Something happens to them, and it is a shift completely for their mind, body, heart, and soul. Usually they're going to identify that experience as negative. They might not even identify it as a traumatic event at the time. So that's really what trauma is.
How is the definition of trauma today different than maybe the definition a few generations past?
Sure, right? So we got introduced to the trauma word, right?
Yeah.
PTSD, those kinds of words.
Yes.
Really coming from the Vietnam era, right? We recognized that people coming from war were having certain experiences that were different from those that had not been to war. So really that's where that language started to develop. Recently, with a lot of understanding about trauma, what the brain experiences, so much research and so much experiential work, we know that a traumatic event could be anything. It could be a wartime experience, it could be a car accident, it could be a medical event, it could even be the death of a pet that can have that whole mind, body, heart, soul shift. So it went from this experience that somebody had to have where their life had to be in danger to recognizing that that didn't need to occur.
I understand. Yeah. What does trauma do to the brain? How does it affect the brain?
Sure. So the brain responds to trauma in a very specific way. The brain is going to put somebody into a fight, flight, or freeze response. Right? So when we have a traumatic event, our brain gets neuroconnected, right? Through a whole series of events that's way too complicated to understand. But what ends up happening is that certain experiences get connected to each other, and that's to help us survive. It also helps us stay in a fight, flight, or freeze response. So the brain will shut off cognitively. You can't learn any new experiences when you're experiencing a trauma. It might be a great example is if you've had a car accident and you get out of the car and people are asking you, are you okay? Where's your car insurance information? And you've had your car insurance information in the glove box for the last 10 years. You know exactly where it is. But in that moment, you can't piece that information together. That's a perfect example of what the brain is doing during a traumatic event. It's shutting out all the information that you don't need, and it's keeping you in that survival stage of fight, flight, or freeze.
Okay. As a clinician, what kind of behaviors do you see that present for clients who come to see you who maybe experience trauma?
The brain can respond in so many different ways. Clients may present with history of depression, of anxiety, of panic disorders. We may see clients have a history of eating disorders or substance abuse, chemical dependency disorders. We may have a client that experiences extreme dissociation or lack of connection in relationships. And they may not even recognize that those experiences are connected to a traumatic event. They just think, oh, I'm feeling a little bit depressed because I lost my job. Or, oh, I'm feeling a little bit anxious and I'm not really sure why. So we see it present in a lot of different ways.
Interesting. So what do you do as a psychotherapist, as a clinician, to help a client recover or improve, deal with symptoms? What are some of the things that you recommend doing?
Sure.
Yeah.
A trauma-informed clinician is going to always take a lens or a perspective through the therapeutic process that this person has experienced a traumatic event. Right? So that's the first and foremost thing. They're going to help a client recognize through techniques of mindfulness, of somatic orientation. They're going to do some techniques that may not even be talk therapy. It may be completely out of the box and something you wouldn't even understand or recognize as part of therapy. Counselors can use a variety of techniques and a variety of orientations. Some of the most popular are trauma-informed cognitive behavioral therapy, EMDR, which stands for eye movement desensitization and reprocessing therapy. So there's a lot of targeted interventions that can be used.
Great. Can trauma be healed in a person? Is there a healing that can take place, really, ultimately?
Sure, and that's a great word, because clients will come to us and say, cure me. Cortnee, please cure me. Make me forget about this experience.
Sure.
Make me just feel better. I want it all to go away. And when we're talking about trauma, we're really focusing in on that word recovery. The end stage, we want to get to a place where a client feels integrated, where they're living a life that is healthy and happy and connected. It's not about forgetting an event, although certainly we wish that we could be like the guys in Men in Black and take it away, right? But that's not necessarily what that's going to look like. We want somebody to be able to say, this event happened to me, and through whatever kinds of strategies and techniques and talk therapy that I used to work on it, I went from this stage to this stage of recovery, and it's integrated. Integrated.
How long does it take to work through trauma in therapy?
I wish I had a magic wand and that we could take it away in 2 sessions, right? Everybody would be happy
Everyone's
with that.
different, I suppose, right? So,
Absolutely. So I've worked with clients for just a couple of sessions. I've worked with clients for several years. It really depends on how their brain has responded to that trauma and how many behavioral symptoms they're experiencing that they want a reduction in. Sometimes trauma, it doesn't go away at all, right? Because of the way the brain works, it's going to stay in our cells. It's going to change our DNA. We've seen research related to that. So it could take a very long time. It could take generations to heal. But we're really excited because there's a lot of things that can be done to help a person get towards that recovery.
Sure, it sounds like it. Do you have any other recommendations about what someone should do if they're feeling traumatized by something?
Sure. Recognize that you are not alone, that everybody experiences moments in their life which are traumatic, right? We talked about just because I never went to war doesn't mean that I haven't experienced traumatic events. And to be mindful and to give ourselves permission to seek recovery, permission to seek help, end the stigma, and look forward to a life of happiness and health.
Thank you so much. That's very helpful information. Appreciate your time today.
Thank you, Rebecca.
Thank you.